Welcome to Move with Care, where we explore popular sports, movements, and activities and how they might be affecting your spine, muscle, and joints. Hi, I'm Dr. Nekessa Remy, chiropractor and owner of Mississauga's The Chiropractic Office and Health Associates. Today, I want to talk to you about joint pain at the gym, particularly with strength and weight training. Now, if you've experienced some pain during your weightlifting journey, don't worry, you're not alone. The joints most affected seem to be the knees, wrists, and shoulders. So we're going to talk about what joint pain looks like and how to avoid it. As a chiropractor, I work exclusively on musculoskeletal injuries, which can happen here at the gym. So if you want information on how to avoid these injuries through proper technique and form, you're going to want to pay attention. So let's begin. As a chiropractor, I have treated a lot of wrist injuries stemming from improper grip when doing a bench press. Oftentimes what happens is, as we go to lift the bar, we dorsiflex our wrists, and that puts a lot of pressure on the small carpal bones in the wrist, which can ultimately lead to pain and injury. Proper wrist positioning involves a neutral wrist position. So that means that the carpal bones are in proper alignment with the two other bones that make up our forearm, including our radius and ulna. When everything is in the right position, we're able to better utilize the muscles in our forearm plus our chest to lift that heavy weight. When in the dorsiflex position, we're really just relying on the small carpal bones and the ligaments to lift all that weight. So once in that neutral position, you'll be able to lift heavier and more effectively. One of the most common injuries I see with overhead press are shoulder injuries, particularly of the rotator cuff, and those muscles are designed to stabilize the shoulder. What tends to happen when we're doing an overhead press is we'll arch our back thinking that it's helping us push the weight, but what's happening is not only are we putting more pressure through the lower back, we're also relying solely on the shoulder muscles to push the weight up. That can lead to fatigue and ultimately injury. In order to reduce those rotator cuff injuries from happening, you want to make sure that your core is engaged during an overhead press. So from standing position, what you want to do is tuck your rib cage down and squeeze your glutes to ensure that the core muscles are activated. And then from here, as you push that weight up, you're now generating a lot of force from the core as well as the shoulders. This is going to limit the amount of strain put on those rotator cuff muscles and hopefully reduce injury. Knee pain is one of the most common complaints I see in my clinic as a chiropractor. I remember learning at CMCC that patellofemoral syndrome was actually one of the most common causes of knee pain. And believe it or not, squats are actually a common cause of that condition. Luckily, through my 4 years at CMCC, I've learned as a chiropractor that I've got a lot of tools that I can use to treat this common condition. If you're performing a goblet squat and you notice that you're not able to get deep enough, or if your knees are buckling in, that could lead to patellofemoral syndrome. But the reason might be due to lack of range of motion or mobility in your ankle joints. As a chiropractor, assessing joint mobility is really important in helping me make diagnoses. And in the case of patellofemoral syndrome, I need to make sure that the ankle has full mobility. If it doesn't, it could mean that you're putting more pressure through the knees, ultimately causing pain. Now, during a goblet squat, what you can do is you can elevate your heels. Here, I'm using weighted plates, but at home, feel free to use a rolled up yoga mat or even a bath towel. Now, as you squat with your heels slightly elevated, you're increasing the amount of dorsiflexion in your ankle, ultimately taking pressure off your knees and allowing you to sink lower into your squats with reduced pain. Now you know how unintended increased pressure around the joints can lead to pain, plus how restrictions in joint mobility can also lead to injuries, particularly rotator cuff injuries, wrist sprains, and knee pain. Now, as a chiropractor, I hope you've learned that we are able to identify, diagnose, and treat all of these injuries. If you'd like more information, make sure to visit one of your local chiropractors. Thanks for watching.